Hi everyone, this is Shalu Kumar again from OSCE Nurse Training Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. So welcome back to my YouTube channel again to another video. So if you like my videos, please press the like button now and subscribe to my channel. So we're going to go ahead and look into another NMC OSCE topic today. So we will look at that today. Okay, so today's topic is all about the A to E assessment, because this is the main reason of fail in your assessment station, and lots of nurses are still failing this, which is the A to E assessment part of the assessment station. So I'm going to go through and give you top tips and give you the idea, give you the main reasons why people are failing A to E assessment. Normally it's just because they're rushing through and they are not doing it according to marking criteria. So we're going to look at it today, how to do it accurately, going from A to E all the way, and make you understand what it means, because if you know what it means, then hopefully you can actually show correct method. Okay, so let's get started. And by the way, we do offer OSCE training, so if face-to-face and online both. So if you would like to inquire about that, then you can email us on oscenurstraining@outlook.com for the prices and the duration of the course. Okay, so let's get started with A to E assessment. So today's topic. So what is A to E assessment? As you can see on the slide, so it's A for airway, B for breathing, C for circulation, D for disability, and E for exposure. Okay, so at this stage now, hopefully you already done patient vitals, or you're going to do it as part of the A to E assessment. Both ways are correct. So you can get the whole set of vitals done before, or you can do it as part of that. But what does A to E means? Okay, so A is for airway. So when you're checking for airway, you can see your patient list. So you will say, I can see you're speaking to me in full sentence and I can't see any obstruction in your airway, because obviously if somebody's airway is obstructed, they will not be able to speak to you clearly. Okay, so you can say that. So as you are speaking to me in full sentence, I can see there is no obstruction in your airway. Moving on to breathing. Okay, so in breathing, you do need to check and say the respiratory rate. That's the first thing. So you will check your patient respiratory rate for 1 full minute and say what the rate is, and also comment on it, whether it's high or low, and the rhythm. So rhythm means is a regular rhythm. So is the patient breathing is coming at the regular rhythm? So that's what you need to look at, because obviously you do this on a real person, on a actor. So you will be checking the rate, you'll be checking the rhythm, and also the depth. Okay, so how is the depth of the breathing? Obviously if the rate is increased, then the depth is short. If the rate is normal, hopefully the depth is normal as well. And just see how your patient is breathing on the day. So you will see if they're short of breath, then you do need to comment on that. Okay, especially if it's shortness of breath scenario. Moving on to then oxygen saturation. So you do need to do the oxygen saturations with the oximeter they give you, and then you need to comment on that. What is the oxygen saturation for the patient? Okay, and then next thing in breathing is the respiratory noises. So breathing is just not only, if you just say respiratory rate and the saturations in breathing, that will be automatic fail. Okay, because this is the assessment of the full breathing pattern. So breathing pattern means respiratory rate, rhythm, depth, oxygen saturations, and then moving on to respiratory noises. So when you check your patient breathing pattern for a full minute, do listen to it. Is there any respiratory noise? Is there any wheeze? Is there any stridor? Is there any rattle? You can ask the patient if they have had any recent cough. Even though they didn't cough when you were checking the respiratory rate, it's good idea to ask the person if they had any recent cough. Okay, next is unequal air entry. So now this is normally checked with the stethoscope, but using that in exam, but you can see the person's chest is moving up and moving equally on both sides. Then you can say, okay, your chest is moving equally on both sides. So that does show that is a equal air entry. So it's not unequal air entry, it's equal air entry. The chest is moving equally on both sides. Next one is visual signs of respiratory distress. So what are the visual signs you can pick up on someone if they are in respiratory distress? So you'll be looking at your patient for use of any extra muscles. Accessory muscles mean extra muscles. Are they using their neck muscles? Are they using their abdominal muscles? So look at that, which won't be the case in your exam, hopefully, but you do need to look at that. And then the sweating. Are they sweating? Is there any cyanosis? Is there any seesaw breathing? So if somebody is using extra muscles like abdominal muscles and the neck muscles and abdominal muscle, you normally see the seesaw breathing. So is there any seesaw breathing? So that's what you need to do. So when you look at the breathing, it's not just the breathing rate and oxygen saturation. That's the most common fail. It is a whole breathing pattern assessment, and you need to do it as in real time on your patient. Okay. Next one is circulation. Again, circulation is just not only the heart rate and blood pressure. Okay, that's where nurses are failing. It's the full circulation check. So it's the heart rate. Then you need to say this is your heart rate. I've checked it. So you need to check the heart rate for 1 full minute and say what is the heart rate, what is the number of the heart rate. Rhythm is irregular. Is the heart rhythm of the pulse regular? And also the strength. Is a good strength pulse? Is a weak pulse or is a good strength pulse? Hopefully be good strength pulse. So that's what you need to say. Blood pressure, then you need to check the patient blood pressure and say what is the reading exactly. And then the capillary refill. So in exam, before you put the saturation probe on to do the saturation, you can always check the cap refill. If you didn't check it then, you can check it now. So you press on the fingernail for 5 seconds and then the color should be back within the 2 seconds. Okay, so that is a good perfusion. If the color is back after you stop, press it for 5 seconds, if the color is back within 2 seconds, then that is normal capillary refill. Okay, and what does capillary refill tell us? Capillary refill tell us the peripheral circulation. Okay, so, if the capillary refill is normal, then patient is well perfused, okay? Because if your peripheral circulation is good, then your central circulation will be good as well. So, the perfusion is good and there's no pallor, okay? So, pallor and perfusion, so you look at the complexion of the patient and then you, hopefully, if their capillary refill is normal, then there is good perfusion, but you do need to comment on it. Okay, you can't just not comment on it. It would be a critical fail. Okay, so moving on to disability. Now, in disability, we also look at pain, blood glucose, and urine output. Why? Because we know if those are not within the normal parameters, either pain, blood glucose, or urine output, it can make a person confused very, very quickly. Okay, so that's why we look at the pain. So ask your patient, are they in pain? Where is the pain? What is the pain score? 0 being no pain, 10 is the worst pain. And then reassure them that you give them regular pain relief. Now, blood glucose and urine output is not given to you in your overview history form for assessment station, but you can ask the examiner for the reading. So you can ask the examiner for the recent blood glucose of your patient and how is their urine output. Okay, and then you know that, but you do need to then verbalize it. Okay, so examiner will give you reading for blood glucose, they will give you reading for urine output, and then you need to comment on it that that's your blood glucose, that's your urine output. Moving on to exposure now, and exposure is all about basically looking for signs of sepsis or infection. So the first thing which tells you if somebody is running underneath any infection or sepsis or early signs of sepsis, temperature. So you take the patient temperature and comment on the temperature now and say your temperature is this. And also then you ask the patient if they got any bruises, any wounds, any injuries, any inflammation, any rashes on their body. Okay, for this you don't need to ask the person to expose themselves or take the look under the clothes. You can ask the examiner or you can ask the patient to confirm with you that they haven't got any rashes, any bruises, any wounds, any injuries, or any inflammation, redness on their body, okay, which could indicate like sepsis or some kind of infection. And then also obtain medical history. So it says obtain medical history in your marking criteria, but you already been given patient past medical history in your history form. It's an overview of history form. So you need to review it. So you need to read the patient past medical history and also probably quickly medication as well, to just make sure there is nothing in patient past medical history or medication which puts them at increased risk of developing infection or sepsis. Okay, because that's why it's included in E. Why we do it in E? Because E is all about exposure, is all about picking up signs of infection or sepsis. Okay, and then we know certain medical condition and certain medication increases your patient's risk of developing sepsis. You don't have to comment what for the particular patient, but you still need to review it. So you will read the past medical history, you will review the medication and say, do you want to add anything more to it? But you do need to review it, okay? And if there is anything you think is probably something there to put patient at higher risk of developing sepsis, you can always say, I will make sure that your doctor is aware about your past medical history and medication, okay? So that's what you need to do, and that's the correct way of doing A2E assessment, very systematically, remembering your marking criteria, not missing anything on the marking criteria. So that way you can make sure that you do not end up failing assessment station because of the A2E assessment, because it's a very common fail. Two common fails. One is charting, whether you're doing news charting or GCS charting, and the other one is A2E assessment. So make sure you got them both revised. So this one is for A2E assessment, and you can watch my video on news charting on my channel, so they're both covered then. Okay, so I hope you like the video, and if you do like the video, please press the like button now and subscribe to my channel. You can also visit us on OSCEnursetraining.com, email us on OSCEnursetraining@outlook.com. Go ahead and check our Google reviews from our nurses who've been having our training, and I will soon be back with another video for you. So bye for now.